All right, so good morning again. My name is Jordan Sheff. We still have people joining, I'm going to vamp for a minute, but welcome this morning. I want to thank everybody for taking time out of their day to join us today. Um, we run a series of these commissioner forums, and we have in a variety of ways for a number of years. We're excited that you're participating with us today. Your feedback's really important. A number of my staff are on to help me with taking notes, capturing the chat, facilitating your needs technically, and there's a whole host of us, but we won't go through all of the intros today. I'm going to speak for a few minutes, and we're going to turn it over to the Deputy Commissioner for a few minutes. Here are just a few forum reminders. If you can hold questions for staff, and the pop-ups are driving me crazy, sorry. Hold questions for staff and presentations until the end. If you are like me and you think you may forget, feel free to pop them in the chat at any time, and don't get discouraged if we don't respond to them right away. If we don't get to them all in the forum, amount of time we have in the forum, we will follow up with any questions you put in the chat to everyone participating today. The presentation's being recorded and will be posted. So if you don't get it all today, or if you have questions, there'll be a way for you to circle back and find out more information. We are going to try and assist with keeping the room manageable, but if you can assist us with remembering to mute your microphone when you're not speaking, that would be great. We do have a mute all function, but then we have to jockey around to unmute ourselves when we're presenting. So we try and avoid using that. If you can help us, that would be great. We're going to talk today a little bit of introduction for myself and Elisa, as I described. We'll get a strategic plan update, and then there'll be time for questions and answers. I don't know what that voice was. Okay. So this is me and Elisa. You'll hear from her more in a minute. But I want to talk a little bit about sort of the format and got some guiding principles. Well, a lot of the work that we have done, we center around Charting the Life course, which is our person-centered planning tool. And we use it not just for person-centered planning, but we use it for system planning and any other type of strategic planning we're doing. It's accessible, meaning that it is adaptable. It uses a combination of both pictures and words. And for those of you who haven't used Charting the Life course in your person-centered planning, it really allows us to focus on not just the individual, but all the other resources that may be available to the individual and the team. It helps us determine our direction and our vision. And so we use that a lot. We baked that into our system several administrations ago, at a time where the Malloy administration was forced to make drastic cuts. And we were trying to find a way to do more with less. And while things have gotten better financially to some degree, in a large way, through the end of the Malloy administration and into the Lamont administration, we continue to believe that that's the most effective way to manage state tax dollars, but also most effectively manage the needs of people we support by providing the right support at the right time at the right cost. And meeting people's needs specifically where they are, instead of trying to plug people into a system. We try and look at people's needs and find how the system might support them and where it can't. And what will lend itself a lot to our presentation today is we focus on criteria. I'm sorry, we focus on that creative energy and how we can support more people in the right places with the same dollars, making room to use those dollars for other people who aren't getting any services at all. So that's just to tee it up. I'm going to pass it over to our Deputy Commissioner, Elisa Velardo, and then we will move on. Elisa, if you'd introduce the team that'll be presenting today, that'd be great.
Sure, I can do that. Welcome, everyone. And thank you, Commissioner. I'm Elisa Velardo, Deputy Commissioner. And I'd like to start us off by introducing a few new team members, so you have faces and names. So Carrie Fillick has joined us as our new Director of Family Support Strategies. Carrie, if you can come on. Carrie has joined us from DSS. Previously, she has a wealth of experience and is going to be a wonderful asset to the department and a connection with families. She is directly overseeing assistive technology, so supervising our director of assistive technology. She's overseeing housing and supervising our director of support of housing and employment and day services. And so is working with our employment and day services team members. And we have some of those team members on the call here today as well. Carrie will also be the liaison for self-direction. She'll work closely statewide with our SD directors, and so may be interacting with some of you in that capacity. Also, since we last had one of these forums, we have established a Children's Services Division. So I want to introduce Tammy Benegay, who is our Director of Children's Services. Tammy's been with the department for a long time and has established a really wonderful team that is reaching out and connecting with families. So hopefully, if you are a family member of a person, a young child, you may have some interaction with our Children's Services Division. And we have our regional directors on the call. And although not new, I'd like them to come on camera and just wave. We have Stacy Silva for the North region, Cress Zaccaroli for the South region, Shannon O'Brien for the West region, and Patricia West for our public services. And if Kathy Hanowitz is on the call for Southbury. All right. So just a couple updates that I wanted to share. We continue to hold our fourth Tuesday forums, the fourth Tuesday of each month. Tomorrow is the fourth Tuesday of October. This has been become one of the favorite gatherings for me throughout the month. The fourth Tuesday forums are an opportunity for individuals, family members, providers, and our DDS team members to share and engage with family members around some of the services that we have. It allows people to share their own success stories, how they're utilizing supports in their lives, and really the real world impact. And so if you join us tomorrow, the focus is employment and day supports. And I can tell you, we have a really, really nice group of presenters that are lined up. We wanted to share with you a little about some work we're doing on making our materials more accessible and informative. We've been working on updating our forms, our written materials that are available on our website. And we're also in the process of translating all of these documents into Spanish, which will soon be available. And so that's a little bit of our focus on better being able to connect and serve all communities throughout the state. And then finally, as the commissioner mentioned, we have Gunnar Abrahamson and Sarah Olaminik who are joining us today. Gunnar and Sarah are two of our amazing project managers who've been working with us throughout the 5-year plan, and particularly around some of our ARPA initiatives. And Gunnar and Sarah, I'd like to turn it over to you, and you can talk a little bit about where we are within our 5-year plan. So welcome.
Thank you, Deputy Commissioner. Appreciate that handoff. Good morning, everyone. My name is Gunnar Abrahamson. I'm an ARPA project coordinator for the Connecticut Developmental Services Department. I want to echo the words of Commissioner Sheff and Deputy Commissioner Velardo and welcome you to the Monday Community Forum. I know we have one set for Thursday evening, so I hope to see all you participate in that as well. I want to preface today's conversation and some of these updates with a couple points. You're going to see some pretty impressive statistics and ways in which the department has made progress in some of the identified goals within the strategic plan, but I want to underscore the point that this work is not done here, right? We still have a number of years within the strategic plan where we can continue to build on some of this progress, and you guys are going to be an important part of the ways in which the department continues to kind of pivot and meet the changing needs of the folks in the IDD population within Connecticut. So at the end of this progress update, I really encourage you guys, if you're comfortable, come off mute and engage with us in conversation. Share your experiences, your feedback, and ways in which the department continued to make adjustments within our service system to meet the needs of the folks that we serve on a day-to-day basis. So welcome. I'm going to stop rambling here. I'm going to jump right into the first topic within the strategic plan that we identified. If we can hop to the next slide here. So the first topic that I'll be covering is daily life and employment, and you'll see immediately underneath that we have 3 priorities from that strategic plan that we identified and want to cover with you today. The first is the expansion of supportive employment opportunities with a particular focus here on our micro enterprise grants. So you may be asking yourself, like I have in the past, what is a micro enterprise? What is the focus of the micro enterprise grant? I want you to think of the micro enterprise grant as startup funding for individuals who are interested in pursuing kind of their own small business. So the micro enterprise grant offers qualified individuals up to $5,000 in exploratory funding to cover some of those incidentals that come along with standing up a micro enterprise or small business. So if you're wondering what a micro enterprise, what an example of a micro enterprise may look like, let's say you have a loved one who, unlike me, is an excellent cook, right? They got all these different recipes under their belt, and kind of any given day throughout the week, you can find them in the kitchen, cooking up, different types of recipes. And on the side, over the past year and a half, they've been really honing in on perfecting kind of their own barbecue sauce, right? It's kind of a pet project of theirs. It's a real passion of theirs. And they've finally gotten their barbecue sauce recipe to the point where it's really kind of perfected. They've handed out samples to family members, right? Brothers, sisters, aunts, uncles, and the feedback from that group has been, this stuff tastes amazing. You can make a little bit of money here. You should consider selling this. So what are next steps? Naturally, you got to find a way to bottle it. You got to create a label that's representative of the sauce itself. If you choose a company name, you slap that on the bottle, and then you got to have some sort of logistical plan for kind of small level distribution, and all that stuff kind of comes with a cost, right? So the micro enterprise grant looks to kind of bridge that gap. Again, providing qualified individuals up to $5,000 in exploratory funding to cover those costs associated with standing that micro enterprise up off the ground. Looking at the slide under the progress indicators portion on the right-hand side there, you'll see the department has awarded over $65,000 through the micro enterprise grant. And we've had multiple iterations of this, right? The Employment and Day Services Unit has had this grant running for a number of years now. Before it was the micro enterprise grant, it was known as the Innovative Employment Opportunity, or IEO grant. And I want to say the department has awarded close to $1 million to individuals who are looking to start up micro enterprises through the IEO grant. So if this is something that you are interested in having a conversation about, if it sounds like something that your loved one would benefit from, I encourage you to reach out to your assigned case manager, have that conversation. They can help guide you through that process. Jumping on down the line here, that second blue colored line. The priority from the strategic plan was driving Connecticut's service offerings towards the agency's employment first philosophy. So you'll hear the commissioner and other leadership mention repeatedly that DDS is an employment first agency, meaning we look to offer a wide and diverse array of employment options for individuals who are seeking some level of employment, or just want to kind of get in and develop kind of a foundational vocational skill set. So we've added 2 new employment-focused support options within the past 6 months. I'm not a subject matter expert on this, but I'm gonna try and break it down for you. The first one is Employment Exploratory Option, commonly referred to as EEO. DDS loves its acronym. So you got Employment Exploratory Option, again, EEO, and this focuses on individuals who are receiving day support option, DSO hours. So EEO is for individuals in a DSO who are really looking to develop that kind of foundational skill set, right? You can think of EEO as a stepping stone to more independent employment opportunities. So maybe an individual is considering taking the leap towards group supported employment, or maybe they want to jump towards individualized supported employment and want to develop kind of a strong foundation before they make that move. The individual can continue participating in their day support option and supplement with some employment exploratory option hours to provide that employment focused lens, so they're better equipped to move into that more independent support when they choose to do so. So again, just to reiterate, the first new employment focused support option is employment exploratory option, EEO. The second one is employment enrichment services, commonly referred to as EES. So employment enrichment services focuses on individuals who are employed in some form or another, right? They're employed in some capacity. And maybe they want to focus in on going after a certificate. So maybe they work in the food industry, they're employed either part-time or full-time, and they want to go get their food safety certificate. So they can supplement some of their kind of employment hours with employment enrichment services that will provide a focused lens for that individual to hone in on that particular task and hopefully accomplish that. So just kind of a quick synopsis of those two new employment-focused support options. The third piece we have here at the bottom of the slide is DDS improving communication across multiple sectors. And one of the ways in which we're doing this is continuing to provide training to provider staff who offer customized employment to individuals. And if you're not familiar with customized employment is particularly focused on individuals who are a high level of need, providers who come in and support those individuals, much like other employment and day service options that we provide as an agency. The provider staff work with the support team to understand the unique needs of that individual. They also act as a liaison between the individual and potential employers within the community. So they work with the individual to understand their unique needs and help bridge the gap between that person and an employer in the community who can bring that person on board. So over 100 folks, 100 provider staff have been trained in customized employment, and this is a relatively new service to the agency. We're just kind of scratching the surface on this one. So you're going to see continued work and a continued focus on training those provider staff in the coming years. Next slide. So the second subject area within the strategic plan that I'll be covering is community living. And this is always an exciting one because it covers things like supportive housing and assistive technology, which again are kind of new and exciting support options offered by the department. So again, looking at the kind of middle piece to that slide, you see three priorities that we pulled from that strategic plan. The first of which is continuing to develop more integrated settings. And one of the ways the department is doing this is through the continued development and implementation of supportive housing units throughout the state. So you'll see a pretty impressive statistic over there, 366% increase in open supportive housing units. And look, I was never really good at math, so it's hard for me to kind of explain to you the significance of that statistic. But I'll put it this way. So 5 years ago in 2019, when these conversations first came about, right, when supportive housing first became something that the department really wanted to take a look at, there were no supportive housing developments anywhere within the state. The first developments came online in 2021. And if you fast forward to today, 3 years later, I believe we have about 8 open developments in all 3 regions, right? Central office leadership, regional leadership have been adamant that no matter where you are located within Connecticut, there should be developments that you can access and reach if you're utilizing supportive housing. And this work really continues. I see somebody.
Hunter, you muted.
Apologize about that. So there are definitely pockets within the state where we need to continue to roll out and do this important work. So we have 8 supportive housing units open and online. We have another 8 or 9 in the queue. So I'd encourage you guys to keep your ear to the ground on this. There's going to be, some pretty good continued work on this over the next few years. Moving on down the line, DDS will increase flexibility in residential options. So one of the ways that we're doing this, and this is really being led by our assistive technology department, is the implementation of assistive technology. And one particular program that I think highlights that very well is the AT&Me program. And in layman's terms, AT&Me helps drive assistive technology into the hands of individuals so they can explore different pieces of tech and how those different pieces of tech can potentially support them in different settings. So over 300 individuals have participated in this program. There are ongoing trainings continuing to happen. So I want to give a big shout out to Patricia Orozco, our AT director, and her team on the excellent work being done there. And this ties in directly with supportive housing, right? So I had the opportunity to visit a supportive housing complex up in Orange, Connecticut the other week. We were shooting an assistive technology video, and one of the ways that this individual was living more independently in her own home was through the use of different pieces of assistive technology. I want to provide a little bit of foreshadowing for that video. I'm hopeful that it'll be finalized and we'll have the opportunity to share that with all of you in the coming months. I think it's going to be one of the most important tools in the department's communication toolbox in terms of explaining the ways in which assistive technology can support individuals, particularly those with a high level of need. And this video, I think, helps to capture that. So stay tuned for that. Our communications department is doing a lot of great work there. The last piece on this slide, and I got a IT operations notification here that my computer is about to restart in 20 minutes. So I'll try and be a little quick here. The last piece is DDS partnering with sister agencies to move forward with transformative work. And I think one of the initiatives that the department is rolling out that captures that very well, and I'm sure some of the folks on this call have heard of it. We have a web page on our website that's dedicated to it, is the Supporting Transformation to Empower People initiative, commonly referred to as STEP. And STEP focuses on a couple things. The first is supporting individuals who are interested in moving from kind of classic congregate settings to more individualized support options. And the second is highlighting some of the progressive support options that are offered by the department, some of which we've touched on here, right? Supportive housing, assistive technology. And through the STEP initiative, 58 individuals at this point in time have made transitions to more community-based support options. And that number 58, I think, is just a small snapshot of the continued work that is happening and being led by our private provider communities, right? I think STEP has provided a vehicle for highlighting and communicating to individuals and families some of that provider-led work. But it's certainly not the only area where we're seeing transitions to community-based support options. I'm going to put a link in the chat here. It is a approved provider approaches document that helps to highlight some of the transformation being led by those private providers through STEP transformation plans. We currently have 22 providers who have approved transformation plans that focus on moving individuals into more community-based support options. So if you guys have some time today, I encourage you to take a look at that. It really helps to highlight some of the work going on there. We can bump down to the next slide. This will be the last area that I'm covering, safety and security. Again, we got 3 priorities from that strategic plan. The first of which is improving internal critical incident reporting data. Critical incidents and conversations around abuse and neglect prevention is something that occurs on a weekly basis here at the department. It's something that we continue to look at and continue to try and make progress on. You'll see on the right-hand side there under the progress indicator, we have a 100% follow-up rate for critical incidents. And I want to make one point here. Does that mean, we get this right every time? No. We are not a perfect department, but we have made considerable progress here. And I want to give a quick shout out to Josh Scalora and our business analytics team, who has done a lot of work liaising with different divisions within the department to really improve the ways in which we're processing and tracking critical incident reporting data. And I said this ties directly into abuse and neglect prevention, and the key word there being prevention. Our training department has revamped our abuse and neglect training, and all divisions, all staff have to take that on a yearly basis. It's something that we continue to underscore as you know, kind of a cornerstone of the work we do here at DDS. And one quick point I want to make, we do have a new website. I'm sure many of you have been on there and had the opportunity to check it out. Before we launched that, I had the opportunity to sit in and listen to some of the feedback from DDS leadership, and it was Commissioner Sheff who said, on every page you visit, every landing page on that website, he wants easily accessible and visible links for folks to report suspected abuse and neglect. So if you go on that website, you'll see kind of right in the right-hand corner links where you can report suspected abuse and neglect, right? I think his point was families, providers, support staff should not have to go digging to find an area where they can report this sort of thing. Visibility and accessibility here is really kind of paramount. And that was underscored in those conversations. So wanted to kind of tie that all together. The second line here, DDS seeking out best practices and staff retention. I believe it was about a year and a half or 2 years ago now that we onboarded our workforce strategies director, Mary Pat DiCarlo, who's amongst other things doing a lot of different work in this space. You may have remembered previous conversations when the American Rescue Plan Act passed in 2021. Our agency received a bulk of federal funding, and part of the way we spent that federal funding was trying to stabilize through stabilization payments for our private providers, stabilize some of the staffing issues that they were having as they kind of exited the pandemic. And that is an ongoing issue that Mary Pat DiCarlo and DDS leadership continue to hone in on and engage different stakeholders in those discussions to find kind of different solutions to that kind of multifaceted issue. So that progress indicator there, 136 private providers have received workforce funding from DDS, again, to help kind of stabilize that issue. And again, plenty of work to be done there. The third piece here, before I turn it over to my colleague, Sarah, is DDS sponsoring an employment network for self-directed services. So we are working closely with Rewarding Work, which offers a job board. So individuals who self-direct and are looking to hire staff can go on to Rewarding Work's website and look for folks who are looking for job opportunities in that space. So Rewarding Work and their job board helps to kind of connect the two parties. So folks who self-direct their services have access to those seeking opportunities, and those who are seeking opportunities have access to folks who are looking to employ self-directed staff. So again, 226 is the average number of job seekers who are active on Rewarding Work each month throughout this year. So at this point in time, that concludes the three kind of topic areas that I'm going to cover. I'm going to hand it off to my colleague, Sarah Olominick. Sarah.
Good morning, everyone. Sarah Olominick. I'm the ARPA Planning Manager, and I'm going to talk about the remaining three areas in our 5-year strategic plan and the different types of progress that we've been making in them. So as you can see on the screen, this section is on healthy living. As with all the work that we do, our focus here is really on how do we best support the individuals that we serve at DDS. And so one of those key areas identified in our strategic plan is really supporting focused work in mental and behavioral health services and specialty areas. And one important way that we've been able to do that is by offering 4 different kinds of specialized support groups available to folks. So we offer support in mindfulness, in social skills, peer support. There are also grief support groups available and dialectical behavioral therapy, which is available for individuals who may be diagnosed with personality disorders. And so that work continues to be possible because of that commitment to making those kinds of support available in a way that makes sense for people to access. I also know that we're saving questions until the end, but I did see a question in the chat about supporting the unmet needs of folks with more complex, maybe medical or behavioral needs. And I want to highlight that in the second area here, where DDS is building connections to upskill professionals supporting individuals with IDD and mental behavioral health needs, we have continued to make progress. We know that this is an area where need does go unmet, and that there are providers who have been working in this space for a long time to support individuals with higher levels of behavioral or medical need. And we've also, through the STEP initiative that Gunnar mentioned, been able to support providers who are interested in expanding their capacity in this area to meet more of that need. So there are 5 providers through STEP who have developed plans that would expand their staff capacity and better enable them to support individuals with more of those complex medical or complex behavioral needs. And that's in a mix of residential and day programs. So we know that this is a challenging issue and one where we continue to prioritize progress as outlined in our strategic plan. So we'll move on now to the next slide. With advocacy and engagement, one of the really exciting ways that we've been able to support progress under these goals is supporting our wonderful self-advocate coordinators to use online platforms to support their work. We know that with the advent of the pandemic, online interaction was seen as a way to make these kinds of offerings even more accessible to folks for whom either health concerns or transportation might be a barrier to gatherings or events that are only offered in person. So a key action step here has been to allow and support our self-advocate coordinators to offer a mix of in-person and virtual options. And we are incredibly pleased to report that they were able to reach over 1,000 new individuals through those advocacy groups in 2023. That was a 145% increase in total participants. And you can see that total number down below, that 3,336 individuals participated in advocacy groups in 2023. So we're incredibly excited that our SACs are able to continue to do that work and to reach more individuals and make those offerings as accessible as possible. And I also want to highlight that, especially under that second line, where we're continuing to support the SACs to educate individuals on the importance of advocacy and engagement early on, that we also supplement that with a partnership with the Connecticut Family Support Network. I know we have folks from there on the call today, and we partner with them to support individuals and families to connect with one another, to share insights, experiences, wisdom. And so it's another really key piece of that, supporting advocacy and engagement through multiple channels in whatever way makes sense for you, for your family members to engage with that. And then we'll go on to our final piece, social and spirituality. As the commissioner mentioned, the life course framework is really central to how we think about providing supports and how we seek to be person-centered. And so we continue to support better education and communication on the life course principles. Those have been built into our latest initiative, like the STEP initiative, and we continue to train more life course ambassadors. At DDS, in our private provider ecosystem, it's a key priority for the department to make sure that there are folks that understand the life course framework and how that can inform the services that we provide. That second line, that DDS will support a network of recreational and leisure activities. We're very excited about our new Enhancing Community Engagement funding opportunity that's supporting providers to do exactly that. So far, over $1 million in grant funds have been awarded to providers who are just starting to implement those recreational and leisure activity programs that are meant to enhance community engagement for the individuals that work with those providers. And so we're very excited to see the impact that will be generated by those proposals. And then finally, we also want to highlight a really important area. I know that the Deputy Commissioner introduced Tammy Venegay, the Division Director of Children's Services, and this Tammy has really made possible for DDS to expand our opportunities, including respite for children in the behavioral supports program. So 2 huge steps forwards. There are 2 new 4-bed respite centers available to children in the behavioral supports program. So 8 new beds available for weekend respite. We know that they get a lot of use, and we're really excited to see such a big step forward to meeting that additional need. And we hope to see that number continue to grow over time. So that gives you a highlight of some of the different key areas where we've made progress. Again, the full report, if you're interested in digging into more of the details, is posted on our website. I know we'll share a link to that. And as Gunnar mentioned at the beginning, we're only partway through. We're a few years into the strategic plan. We're excited to see continued areas in continued progress in all of the areas that we've outlined. And we know that the work continues beyond that. So within the next couple of years, we'll be looking at the next strategic plan, and we know that there will be opportunities to make your voices heard about key priority areas that the department should be aware of and should be engaging with. And so we invite you to keep an eye out for those, and thank you for those of you who did offer your input and your insights into helping us develop the current strategic plan. And with that, I will pass it back.
Thanks, Sarah. Commissioner, do you want to take it from here, or would you like me to?
I was struggling to find my unmute button. I apologize. So no, thank you, Gunnar and Sarah. That's really helpful. I just want to acknowledge there is a lot of questions and a lot of detailed questions in the chat, and we're going to work through those, but we won't do justice to all of them today, but we will do our best. So this is an opportunity now when I can find my page for us to take. I'm just double checking before I do that. Yeah, so I think at this point, Kevin, we're going to look to take questions. I want to acknowledge for those folks on the call, one of the areas that we are spending a significant amount of time, and significantly more time than we'd like, is on the transition to our fiscal intermediary. We have lots of meetings about that, some internally, some public facing, and we can certainly entertain questions about that today as well. But we may encourage you to follow up with email or attend one of the other forums specific to that. But I don't want to, it is that and workforce issues are the two most burning issues of the day for us on almost any given day recently. So I don't want to take the opportunity away from people on the call today to discuss those issues as well. Kevin, do you want to help with or help with the chat and or hand raising and all of that?
Sure. Thanks, Commissioner. I'm going to just start the first of the chat, and then we can go back and forth with the hands that are raised. But the first question from the chat comes from our Buds person, Shannon, and she's looking if there's a list of providers who offer customized employment.
Yeah, we can talk. I see there are a couple questions around employment, the presentations for the Fourth Tuesday Forum tomorrow. Trevor, are you on? Perhaps you can share a little bit about the presentations for the Fourth Tuesday Forum, and then there's specific questions around customized employment. Are there success stories? And I think we've dropped a list of the providers who offer customized employment in the chat, but maybe you can talk a little bit about customized employment.
Sure. So, and I'll make sure that the list is in the chat. It is online. So we are actually currently working to do some outreach to our providers to get some of those success stories. But I can share one really briefly. We have an individual who was able to find the job he wanted working for DEEP, so one of our sister agencies at the state. And I don't want to give away too much information, but he's very happy in his job. He wanted to do something where he was working outside, and he got exactly what he wanted. We were able to negotiate it a little bit so it fit his needs. I know there's an individual who was able to negotiate a position at a horse farm, and there are a few more, but we will be sharing some success stories tomorrow at our Fourth Tuesday Forum, so please make sure to join. Thank you, Trevor.
The next question I'm going to take from the chat, and then I'll go to hands, is from Natasha. And Natasha asked if there's any new videos based on community living, and I can answer that. Yes, Natasha, we're working on creating more videos, and they should be coming out in the coming months, as Gunnar mentioned. So I would just tell everyone here to keep an eye out, and we will share those through our newsletters and other social media and other avenues. Chris Allen, your hand is raised.
Well, congratulations on everything that you've done so far. It's very impressive. You know that my concern is medical needs. Individuals in the department who have developed medical needs and are living in hospitals. Anything that's happening in the strategic plan.
So part of the strategic plan is to better meet the needs of everybody. So that would include people with complex needs, both behaviorally and medically. Medically, we have done a couple of things. We have a lot more we need to do. We have opened a medical step-down unit in our public programs. It still does not have all the levels of care that you might find in a long-term nursing facility or long-term rehab facility or hospital. We are looking still to build some capacity there. There's a couple things I can't share because they may end up in contract, so I can't share specifically, but we may end up contracting for some of these supports and services. But we are investigating the ability to use technology, not to perform medical procedures, but to provide levels of oversight and observation and triage that may really help us better support individuals in medical needs. We are aware of a number of people living in hospitals due to primarily insulin dependence and respiratory issues that we really struggle to care for in the both public and private provider community. Both of those either require ongoing oversight from a respiratory therapist or a doctor who's a pulmonologist, and a nurse to triage insulin levels, as that's considered assessment by the state. We think there's some opportunities in both of those areas. Additionally, we're working on a request for information that we will publish to learn more, both internally here in the state, what resources available, but also from providers perhaps out of state or state agencies out of state that may have guidance on how to help us improve in those areas. So there are a number of irons in the fire. They're not yet bearing all the fruit that we hope that they will, but our fingers are crossed. We're particularly both of those issues. We're really focused on the insulin, being able to support people with sliding scale insulin needs in the community, and people who have complex respiratory issues in the community.
Have you tried working with any of the nursing homes? Not that you want a young person living in a nursing home, but some of them do have respiratory services available and they're closer to their families than the hospital. There is so many incidents that are happening in the hospital right now that are life-threatening. It's just every day there's something going on.
I would love to tell you we only have people. I would love to tell you we only have people who are getting that care in hospital settings, but we do have individuals with intellectual disability and complex respiratory needs who are at nursing homes currently or respiratory rehab facilities. We have not. I'd like to understand a little bit better how you might think we partner with those nursing homes.
The ones that I've talked to, yeah, the ones that I've talked to don't have expertise in developmental disabilities. But they also don't get the rate that they might get if DDS also provided a portion of that funding. If they could do that in a setting like that, I think they'd be more willing to take when they're looking at somebody who has complex medical needs and developmental disabilities. They're more likely to take the elderly person who just has a respiratory issue and who is cognitively intact. And
I appreciate you giving me a better idea of what that might look like. We will take that offline because I'd have to talk to our Medicaid folks about what rates are allowable and how that might look. But let us, Stu, I appreciate another suggestion to try and help us make that better. And let me see what we can figure out when we discuss internally. Thank you for that.
Commissioner, I'm just going to jump around, go to the chat next, and then we'll go to hands. If you don't mind, just maybe giving a broad brushstroke on what's going on with GTI independence and maybe just touch on that? Because we do have a
Sure.
couple things in the chat.
Yeah, if I can just on a broad basis, we have a number of people committing a lot of time to trying to smooth out that process. And let me begin by saying, there are for a number of people, many people who are receiving GT their fiscal intermediary services through GTI. For a number of people, it's going great. And in fact, someone just popped in the chat that they like it better than what they had before. There are also a number of people for whom it has gone poorly and repetitively gone poorly. That's a particular concern to us. The issues remain around wait times, enrollment of new staff, and timeliness of pay, and a couple of other issues that are maybe not as glowing bright on my radar as those three. So we meet with them routinely, multiple times a week. We have done a couple of things. We have brought back Joe Carvalho as a senior policy advisor in my office, whose initial body of work is going to be dedicated to trying to get us to a better place with GT. We've also brought in a contract consultant to project management the improvements necessary there through our business partner Deloitte. That combined with what we're doing with the sister agency at DSS, who also is facing who's also facing similar struggles with GT that we are. We're working with them, and lastly, we have an escalation spreadsheet and other ways that we can try and escalate concerns you have. But someone just posted in the chat as I was talking, they're in fear of losing 2 long-term staff, and unfortunately, we have seen that multiple times. So we are looking at all the options. We're going through the contract. There are some things that GT has suggested we owe them that we're working on producing, if in fact we owe them anything to make this better. And that's where we stand right now. We will continue to update. And I don't know if Lisa or Joe are on the call and want to talk a little bit more specifically about how people on the call today might seek some remedy for where they're struggling with GT.
Yes.
I think Joe was not able to be on the call today.
That's
But I think you've covered it. If you
Okay.
have an ongoing issue with GT that has not been able to be resolved, you can certainly reach out to Joe Carvalho, and we can put his contact information in the chat. He has been very, very engaged in working with families and making sure that issues that have not been resolved are addressed and come to resolution. And so I know that I believe he'll be joining us on the Thursday night forum, but he couldn't be here today. But I know that he would welcome the outreach.
Thanks. So we'll drop Joe's email. It's joseph.carvalho@ct.gov, but we'll put that in the chat so that you have it and you have the right spelling. For those who are unfamiliar with GT, GT is our new fiscal intermediary. The next question will be, what's a fiscal intermediary? Because if you don't self-direct and self-hire your supports, it may be very foreign to you. So when we provide authorizations for families to hire directly staff to work for them, or when we make authorizations for the individual we support to hire people directly to work for them, that money flows through something we call a fiscal intermediary, which we abbreviate to FI. We had prior to a little over a year ago, prior to last March, I used 2 FIs, Allied and Sunset Shores. There were a lot of concerns expressed over a number of years around Allied, both to DSS and DDS. So we made the decision to look for a new partner, and we ended up with GT, which does great in a whole bunch of other states and has been struggling to get things 100% accurate here. So that's just a little history. So that's what an FI is, and that's what GT is. So I can take more specific questions if folks have them, Kevin, but we can. I'll follow your lead.
Yeah, I'm going to go to thank you, Commissioner. I'm going to go to the next hand raised. Kurt Danforth, your hand's raised if you want to unmute yourself.
Hi, thanks for taking our time. And it's actually in sync with someone who put in what progress has been made to address housing needs for those with profound needs. So our situation is, our son Christopher has been supported, thankfully, by Edelbrook, living up in Southington, Connecticut. We're in Stonington, Connecticut, which is in the southeast region. And I think it was probably about 2 years ago, we were talking about how hopeful we were that we could find him a place to live nearer our residence, but there's not been any progress in that regard. Meanwhile, he's been in a day program up there, which, you know, we were thankful to find a day program that was willing to take him as well. And they told us and DDS last week that they are giving him a 30-day notice they can no longer support him due to behavioral issues. So it's a challenge that we know you know about, but it's sort of frustrating for us to not be able to see a way out of the box. And sort of secondary to that, I think it was maybe a year ago or so when we were looking for the day program, and we were on with Elisa and we talked about the frustration of not being able to parse through all the data to find the day programs. And it would be really great if the people working on the forms that you have the agencies fill out are sort of a checkbox list of all the things they do. But it would be wonderful to not have to dig through that alphabetical list by town to figure out, of the 30 things listed, which are the 5 that have day programs. Anyway, so that's a lot for you to take in, but
we really need to get him home. He's way so far away that we cannot keep track. We can't keep track of the staff at the house. We can't keep track of the staff at the day program. And he misses out on holidays and family visits and other events that go on in the community where he grew up and where people knew him. So
Thank you for all
need
of that.
help.
Yeah, I know, and we are working on it. And as you know, as you mentioned, we're conscious of the challenges. So I would say that we are doing a number of things to try and improve our capacity there. The number one issue for right now with individuals with complex needs is providers having the ability to hire enough staff to take on individuals that might have either complex needs or high levels of staffing. And so I think that there are providers under normal circumstances who are out there who would be interested in supporting more people with complex needs. We are not, but they cannot currently hire the staff to do that in the volume that we need. So we are working on a lot of things, and it seems disconnected. Bottom of our complex needs issue means coming up with thousands more staff to fill all the holes throughout the industry. I think we're talking about a number in excess of 5,000 we think we need for the provider community to feel closer to fully staffed. That's a big chunk of people. And I don't know that that's going to get better fast, but we do have a number of things in the works to improve recruitment and retention. We consider things within the rates and are looking at issues there. We have provided opportunities for a number of providers to engage in training around trauma-informed care and complex needs so that they can better retain their staff and train their staff. And we're starting to see that that has a positive effect. We saw a presentation from providers on that last week. They're doing their own learning collaborative through several partners. Additionally, I mentioned that RFI earlier, the request for information. And I hope that brings us additional resources to look at too. And lastly, I can let Elisa speak to the second part of your question a little bit more, but Elisa is also working in collaboration with a number of people on complex support needs in multiple environments. So it's not fast enough. It doesn't give you the confidence and the hope you were looking for in a response from me today, other than to tell you that we are busily, actively working on it and painfully aware of the deficits that we have in the system right now that don't allow us to support everyone's needs, whether it be medical or behavioral. Elisa, I know that they mentioned in the second part conversation with you around employment. Do you want to help with that?
Sure. It's good to see you again. In terms of employment specifically, one of the things that we did do this year that hopefully, I'm sorry to hear about the 30-day notice, and I know that that can be stressful. So two things. One is we have an incentive in place for providers to either expand day and employment opportunities or to accept new individuals. And that incentive increases based on the level of need of the individual. And the hope was that, to your point about portability, that if a person wanted to exercise portability, they would have options available to them. And so hopefully that incentive that's in place right now will make options more plentiful as far as day programs that you're looking at. To your point about that list, very well taken. And as it is cumbersome. I know that it is cumbersome, and it is taken longer than we would like to have a more user-friendly version. But that is identified as a need, and as we look at accessibility of materials, that that'll be high on the priority list. You're not the only folks that have had that feedback, and I have struggled with it myself. So it's more complicated than it looks when reviewing on the website, but our goal is to make that much more user-friendly.
Well, Lisa, when we were, they notified us and our case manager through a phone call or Teams meeting. And the case manager was sort of saying that the next step would be they just sort of publish Chris as sort of needing services, but not like go out and try to contact agencies directly. I mean, is that the standard to?
Is that for the residential portability or for the day services?
Sorry, for the day services. Yeah, for the day services.
No, I think we can follow up with that, but there should be outreach to identify who can meet his need in that area, and actually support with outreach around that.
Yeah. Okay, great. Thank you.
I'm going to go to Natasha Cole next. You've been patiently with your hand raised.
So, good morning, everyone. I had learned a lot today, and I realized, like, one of the biggest topics we were focusing on is like abuse and neglect, and then also the medical field. And I would like to talk about starting the life course and also other GTI, and also I am part of that too, because I'm a self-advocate coordinator in the West region, and I have supports, and it's really wonderful strategic plan. And there's also health services, and I'm also part of the health services too. Thank you very much.
Thank you for sharing, Natasha. It's good to hear from you, and I appreciate the work you do, you and your partners, the self-advocates. So thank you for saying and doing all that.
Thank you.
I'm going to go back to the chat, and there's a couple questions on the presentation about providers in recreation and leisure activities. Twofold. Is there a list of providers offering those recreation and leisure activities? And then how can providers apply for funding for that?
Elisa?
we can provide information. Sarah or Gunnar, I don't know if you have this handy. If not, we can follow up. But in terms of the community engagement opportunities that are available around the state, we can provide that information. And then in terms of the second part of that question, how can providers get funding? Is that correct?
Yes.
I think
Sarah talked about grant opportunities for increasing community engagement.
so we did award all of the community engagement funding that was dedicated funding, but if there are person-specific needs that have been identified, certainly the provider can work with the region. But in terms of our dedicated community engagement funding, all of those funds have been awarded at this point in time.
Thanks, Lisa. Just quickly before I go to Patty, Warren asked if the chat will be available after this call. The chat should be, but we will have we'll have a recording of this plus the presentation, everything we talked about today available on our website, and we can also send that out as well.
And
Patty
Kevin,
Silva.
excuse me, Patty, before you go, I don't know if external users can see the chat after they're done in the meeting today. So I think we'll make an effort to grab that and include it in whatever we post so people can see that. But we will wait until after the second forum this week to do that, so we can do it all in one.
I was
Patty?
wondering if I could just interject. I don't want to jump the line. My first time, my name is Ed. I don't know how to raise my hand. So at some point, could you check in with me?
We're going to come right to you
next.
next, Ed.
Okay, thank you.
Patty?
Hi, everyone. I just wanted to make everybody aware that I put a link in the chat to the, it's a guide for individuals and legal representatives when an allegation of abuse or neglect has been made. It was something that the Council on Developmental Services had worked on for over a year, and it's been finalized. It is on the website, but it's very difficult to find it right now. I think it's still got to weed its way through the new structure of the website, but there is a link there, and it's a 3-page document that is the intent was to really make it family friendly, so that people could really understand, and not so much the lingo that can sometimes bog things down, but it's pretty descriptive about the process and what you can expect. So I would encourage people to take a look at that, because like I said, right now it is difficult to find, but if you save the link, you'll have it for further information. So thank you.
Thanks, Patty. Ed, you're up next.
Hi, thank you. My sister Shirley lives in a group home in Milford, and her family lives in Cheshire. I won't get into all the background, but very dissatisfied with the group home that she lives in. I was wondering what's the best way for me to go about moving my sister to a group home other than the group home that she's in. And while we're at it, as the family prior requested, a group home possibly closer to her family.
Thank you, Ed, for the question. So we won't speak specifically about your loved one, just because this will be public and published, but I'll speak in generic terms, which I think you'll find helpful. So as with most things at DDS, when it comes to an individual, that conversation typically would begin between the individual, their loved ones, and the case manager. We have a practice, long time practice, where individuals can, I'm going to use a trade phrase, exercise portability. That means that the individual can tell the department, I'd like to move with my resources from one place to another. That can be done in day, that can be done in residential, and it can be done between different levels of programs. I won't get into all the details about how that how we handle the funding on that and how that process works. Prior to the workforce crisis we had now going on, there was a lot of movement of individuals from one provider to the next, even staying with the same provider and just wanting to move from one group home to another, or from an apartment to a group home, or a group home to an apartment, and any of that type of movement. So people should have a choice where they live. Ideally, while the group homes are not best suited for it, they should have a choice of who they live with to the degree that's most possible. So for anyone else on the call who's interested in maybe seeing their loved one move, start that conversation with the case manager. Tell them that you're interested in exercising portability, and then there's a bureaucratic process that'll unfold behind the scenes, and we will start to work with you to find a provider, whether that's based on their skill, their quality, or their location.
Thank you.
I'm going to go back to the chat quick. Beth Lambert had questions around autism, and she says, what training does DDS provide to private providers on working with individuals with autism? And do we know how many individuals does DDS support with autism?
So that's a very interesting question, because it just came up for me last week. We have a rough idea of the number of individuals we support who have intellectual disability and co-occurring autism, but we don't know that completely. And the reasons are multifold. One, we have individuals who probably received diagnoses when they were young and in high school, and before there was a broader definition of autism spectrum disorder, who, if they were tested now, would probably fall under that umbrella. But we don't have any paperwork to suggest in writing a confirmation of that diagnosis. So while we can tell you roughly the number of people who have both diagnoses in our care, I don't have that at my fingertips. It also will be inaccurate, because there'll be some underreporting and potentially overreporting in that number, but we can share that in the responses to the forum later. The first part of your question was around training. We have a number of baseline trainings that we require providers to do. That is the floor for those trainings. Providers are encouraged and often provide a lot more extensive training than what we offer in our curriculum. And there are a number of agencies that really cater to individuals who might have issues resulting from being on the spectrum. And they tend to be, more likely to train folks from a behavioral perspective than some of the other approaches to supporting individuals we have. This goes back to a question asked earlier, how do we display providers, what locations they're in? How do you know who's good at autism and who's not got a lot of autism training? And I don't have a sharp answer for that, other than as we look to that question about how we share information with you about the provider network, how we might also share providers who tend to focus more energy and training across the board within their organization.
And I can add a couple things. One is in the work that we're doing with individuals with significant needs, we're looking at training that's gone on. We have Dr. Peter Tolosano within DDS, and also our Children's Services Division that has had quite a strong focus on training to see if we can harness some of those recordings and have them available on our website. So that is in process. And secondly, starting July 1st, we have expanded the number of days that day providers have for staff training. So we built into our rates for our day providers 2 additional days of training. They can determine, based on the folks that they support, what the focus of that training is. So if they work with folks with autism, they may identify that as a training need and offer specialized training. If they work with more medically involved individuals, perhaps that'll be the focus. The commissioner mentioned some of the trauma-informed care that has been incredibly helpful in terms of training direct support staff, but they do have additional training opportunities that are built into our day and employment provider contract. I hope that's helpful.
I got two questions around how can we find some more support for parents with ID. I guess there's a thought of maybe adding a section to lawn, and that it's a different complex needs, life skills, and support to keep families together. So.
Yeah, I don't know that we have a quick answer to that today, although parenting with ID has come up recently in the last couple of weeks for me for other reasons. So I don't want to give just a bunch of lip service to that question, but perhaps I'll respond better to you after we finish a little of the research we just started. Elise, I don't know if you have something particular to share on that.
I do. I was just at an event where I was actually seated next to a self-advocate who's a parent with ID, who was talking about a group that she's recently joined. I know that they presented at the People First conference. And so let me see if I can get that resource and drop it in the chat. But she was saying that it was incredibly helpful as a parent with ID to join with other parents. And so I'll see if I can drop that in the chat.
Thank you.
Another question around, is there a plan to increase pay for day and res program staff in order to make the position more attractive to people?
Say that again, Kevin.
Yeah, is there a plan to increase pay for day program and residential program staff in order to make the position more attractive to staff, to people?
So we don't have a specific plan that I can talk about today about how that might work, but we have a number of things that we are talking about internally, excuse me, to better to take a look at how we might better support providers to provide different levels of staffing, more enrichment, more training for individuals with complex needs, and then the work we're doing across the board for all DSPs in our workforce development efforts, both partnering with the Governor's Workforce Council and a national learning collaborative on increasing the number of people and the quality of staff within the space that we operate in, what we refer to as the Home and Community-Based Services space, HCBS. But we'll just call it our space for now.
I'm just going to run through a couple more questions in the chat, and then I'll go back to you, Natasha, just so we can get first questions done. Is a question around fiscal intermediaries. Is it possible for a family member to take on the FI role or to identify a FI to employ?
So currently the contract, the way it's written, as I understand it, states that there'll be a single fiscal intermediary for the state. So the question for the moment, there are ways that an individual can use a portion of their appropriation to get assistance with managing that process, but it would still be through GT. So we have a goods and services broker package that allows an individual with intellectual disability to hire somebody to handle a lot of this process. We will be exploring what other options may be available to everyone as we continue to work to improve the product we have in place now. Not a satisfying answer, I apologize.
I got just a statement that it'd be helpful to have a slide with the DDS staff contacts, the people who presented today, and I can answer. That would be something that we can post on our website, as the commissioner said, after our second forum with all the questions and answers. Is there a plan for more CCHs in the state?
So I have to check in with my CCH managers in the region. We are if you are considering CCH, we are happy to start the development process for a CCH placement and development with you now. There, you don't need to wait for a waitlist initiative at present or specialized funding. If you are interested in exploring a life and community companion home, reach out to us and we will get you started with that process.
And I can
CCH.
echo that. We're continuously doing CCH development. And I met with the CCH managers statewide. There is continuous development happening in that area. So definitely explore within your region, but there are new licensees all the time.
And a CCH is a community companion home. And so what's a community companion home? Community companion home is a licensed location where a community member decides that they would like to share their living situation with an individual with intellectual disability, and there is a stipend offered to that homeowner, that family, that community member, to offset some of the expenses. There's someone in the chat who's been not thrilled with the CCH program, and I understand that there are some individuals who are providers who don't feel like the stipend is enough. And so we actually have looked particularly for individuals with complex care needs and for other issues, potentially enhancing the funding for CCH and some of the items that go with that. But I think it's too early to share any of the details on what those rates will hopefully look like as we go forward.
Natasha, you have your hand raised.
Thank you. Talking about providers, because I know in the Advocates Corner, like they have different prospects, because what you mentioned, they're different from what we do. Is that correct?
I'm not sure I understood the question.
Okay. So talking about providers, what you mentioned earlier, yes, and we have the Advocates Corner that is open to everyone, and I realize that they have different providers for different reasons. Is that correct? Anyway,
I believe that is correct. If I understand what you're asking, Natasha.
Yes, because right in the chat I mentioned like the advocacy groups are separate. I don't know which one you are actually referring to. You know?
Okay. Yeah. So I think the question earlier was trying to sort out where provider groups might be, where providers might be around the state. Are you saying that we should have something similar for the advocacy groups that happen around the state?
I think so. Or it may be different. In this also strategic form is totally different, I believe. I think.
Okay. So we're going to reach back out to you, Natasha, to make sure that we understood what you were asking for, and then see if we can make that improvement.
Commissioner, do you mind touching a little bit on paid parents, paid family caregivers, and I guess questions around the stipend potentially not being enough for family members?
So I'm just trying to see if Krista's on, because she'll do a much better job than I
Krista
will.
had to leave for another meeting, so she just had to head off.
All right, I'm going to do my best, and I'm going to tell you that I'm not going to get it all right, and that we'll have to follow up with you. But in this last year or so, we amended our waivers so that there's a possibility in certain circumstances for individuals who are family members who weren't previously allowed to be paid as caregivers. There was a very limited list, which has been in place for a number of years, and the way that's governed. The recent change allows for additional people who wouldn't have been able to be paid under the prior structure to get paid now. What that amount of money looks like depends on the services and supports that would be offered and the number of hours that would be needed to fulfill that support. It's all of that happens at a person-centered level. We build a budget, we build a plan together, and then we see what the resources are needed if the budget and the plan don't match, and how we go about addressing those.
Thanks, Commissioner. A question from, I guess Barbara, your hand's raised. We'll go to you next.
Hi. I have a couple questions. First of all, how many people, I don't know if you have, are able to come up with this statistic, but my son's caseworker said that there really are very few people like him that are independently living in an apartment building, just a random apartment building, who have intellectual disability, and he is. And everything is going really well. Actually, I mean, he's done an incredible job of advocating for himself. However, the downside is that there is no community. He's the only person with an intellectual disability living in his building, and let's face it, people aren't lining up to be his friend. So I have some concerns with the position of congregate housing, the whole philosophy behind it, because it doesn't seem to really be working. He's independent, he has independent skills, but there's not enough emotional or social support for him in the current setting that he's in. I did ask around and found out that there were some cluster homes, 8 of them, I understand. But they're all sort of mostly in the Hartford area. He's in lower Fairfield County, and nothing seems to be happening down there. And I understand it's because of real estate costs, but I'm really interested in how we got funding for these cluster homes, how that happened, and what I could do to on my end to try to facilitate something like that happening in lower Fairfield County, so that my son would have the social support he needs without having to move out of his community.
Thank you for the question. I'm going to turn a lot of this over to Elisa, but I want to begin by saying we have hundreds of people who live in their own homes, whether they're apartment rentals or own houses or mobile homes or all sorts of different settings where people with intellectual disability are living independently. It's not as common as some of the other living settings that we have, but there are lots and lots of people in that boat. Over the last 6 years, 7 years, we initially received funding through something that federal housing rounds through a program called IDASH, intended to help intellectually disabled and autistic individuals gain access to affordable housing in their communities. It started slow and with not a ton of money. We are up to, and Elisa will give all the details here, a much bigger number than we were 6 years ago when we had one up in the Farmington Valley area. Those programs those housing developments are set up so that no more than roughly a quarter of the individuals living them are individuals who are intellectually disabled. So it doesn't become a little mini institution where everybody on grounds has intellectual disability. And we anticipate, since the IDASH funding expired, we have tapped into a variety of other federal housing rounds. And that actually initiates at the Department of Housing, developer and a provider bringing the need and awareness. I've begun to penetrate communities that we have struggled to penetrate previously with affordable housing. The decisions on where affordable housing in the state can be are governed at the local level. And so there are some communities who are reluctant to allow for affordable housing in their community. And I don't know about your son's specific town or other areas
in Stanford.
Yeah. So I'm going to ask, Elisa can give you a better idea of where the developments are currently in place and what may be coming online after, and any follow-up questions you have. Elisa?
Thanks. And you did a really nice job, Commissioner. I want to reiterate, there are hundreds of people that are living in their own apartments across the state, and the isolation or the, connection to the community piece of that is really important, Barbara. So I know Shannon O'Brien, the regional director for the West region, is on the call. And I think maybe starting there, looking at what resources are in the Stanford area. If your son's doing well and he likes his apartment and he's looking to connect within his community, I think we might start focusing there. In terms of supportive housing, there are supportive housing developments that have gone, that have opened throughout the state. You mentioned clustered IHS or clustered housing. So I'll try to very simply give the various options. Your son living in his own apartment is individualized home supports. So he's in his own apartment. I assume he's got some staffing supports that go along with that.
Yes, he does.
And then the next would be clustered supports. That's where a couple people may live in close proximity to one another. And so they have staffing supports. They also have access to staffing supports overnight. And then there's supportive housing where people may live in the same building or complex. And so that's clustered IHS, but in a particular development, and a number of units are set aside, no more than 25% of the units in the building that are set aside. So all of those options are available. But in terms of that community engagement, I think that we can really look at what's available in the Stamford area that might offer what you're looking for. So no necessarily need to move into a new location, but really look at developing community options within that area. And so Shannon O'Brien is on the call. I know you're in that Stamford area. We can connect afterward to see what we might be able to offer.
Thank you.
Thank you.
So we've got about 2 minutes left. Kevin, I see Ed has his hand back up, and I'm glad Ed figured out that hand raising function.
I just
Barbara,
figured
were we able to answer your question before I take Ed's and then wrap up?
Yeah, you were. I just would like to know what the next step is. Who do I contact about finding out about these?
So I would contact your case manager. I know that you were suggesting you got an answer from your case manager that sounded a little different than what Elisa and I just said. But they have a supervisor and other managers that they can work with if you don't get the response you're looking for or doesn't seem to be in line with what Elisa and I just said, feel free to reach out and we will try and help with the situation.
Thank you.
Ed?
I have more of a comment than a question at this point, but somebody had mentioned improved pay for residential staff, and I'd give a shout out to that. I know that improved pay doesn't necessarily guarantee an improved employee, but it does improve the pool of people that are applying for these jobs, which in turn, could exclude some of the folks that maybe aren't doing as good a job. I know the group home my sister's at, there's been openings where there's been one person applying for the job, and so it's one opening, one person, you get what you get. Whereas if you had 25 people applying for that job, you could take the best person and the pay increase. But I know that's a tough one, the financial.
So I appreciate that. We are caught in a situation where we don't have even if we offered more money, that doesn't produce more bodies, because while I talked about the 5,000 needed for this sector, I think the state is looking for 30,000 employees across multiple fields. So we have to, 1, see what we can do about pay. 2, see what we can do about turning it from a job to a career where people can enter it, not just thinking it's a stopover to whatever they do next, but something that they can do where they can grow, where they can earn a decent living, where they can perhaps learn to move further into a human service career, a management career, a healthcare career, in ways that they can feel supported. A lot of that comes back to how do we train them, and that's for retention. So I think there's a number of variables. Pay is certainly one of them, and we are very conscious of that.
Thank you.
Commissioner, one last question from the chat. Just looking for some clarification on the behavioral support groups that were mentioned. I guess this was the first time some people were hearing about them.
So I'm not sure which particular behavioral support groups. we're talking about there, Kevin. I'm sorry. Elisa,
No
do you know what
problem.
the question's references?
I think, sorry, my camera's off. I believe that question was maybe in reference to the groups. Dr. Tolosano oversees the those support groups for individuals across the state, those 4
Yeah.
areas.
Thank you, Sarah. I think that helps Elisa better answer that question, maybe, or you want me to take that?
I saw the question earlier. So I'm not sure, Sarah, the support groups that you're referencing. I know that we have a number of support groups throughout the state, depending on the area of the state. So if there is a specific area of interest, we have our self-advocacy groups that are certainly strong and vibrant across the state. We have Healthy Relationships, which is a wonderful resource for people across the state. We have some specific groups around people that are bilingual or people that are going through grief or loss. So if there's a particular area, it would help us to make a connection with what group might be available within the state. I hope that's
So I
helpful.
think, yeah, I think when we look at behavior, that some of it is based from what we learn about individuals on the spectrum. Other behavior is exists for other reasons. And some of the care responses. So while an ABA approach works, an applied behavior analytics approach works for a lot of people, it doesn't work for everybody. It doesn't even work for everybody who has autism. So we approach behavioral support all from a positive behavioral support perspective. In that we do that where necessary. We look at or where helpful, we look at the autism approach. We look at a trauma-informed response. We look at a psychotherapy response for those who can engage in it. So we do look at behavioral needs, and we do have support, training, consultation available in a lot of different ways in groups that meet. But the help in behavioral support really depends on the individual receiving it and the type of therapy and approach and learning that's going to best meet their needs. So to Elisa's point, if we know the individual in the specific area, we can point you better towards some of the work or conversation that's going on, and also whether your primary concerns are around day, residential, or both, because we do have some providers who are particularly interested in evolving opportunities for people with complex behavioral needs in the day area, and we do have residential providers who are investing in some of the strategies I talked about earlier to make capacity in our existing living supports, group homes, and other models. So Kevin, are you ready for me now?
Yes.
All right. So it's 11:34. Let me first begin by thanking you for all of this. You are my eyes and ears. You're the voices for so many, and the voices for so many who don't have their own. And so I appreciate all of this. It helps while Elisa and I are busy every day trying to improve our system to improve better lives for people with intellectual disability. We need everybody at the table to contribute ideas, and I absolutely heard a couple things today that are important to us to add to the work that we do to make a better system. I also want to touch on one thing that I think came up early on, and I don't want me or my staff to forget it. So while we were, what I want to say is around community engagement. Those of you who've been around with me for a long time and around longer than I've been here will remember times where we had staff that worked for the state who helped publish calendars of things going on within our community or outside of our community, but that would be very welcoming and supportive of individuals from our community. And during the several administrations ago, we lost the opportunity to produce those types of calendars. And I do think if we can have some sort of shareable resource, I know that there's a movie theater in one region that does sensory nights so that people who have significant sensory issues can go to a movie and enjoy themselves without massively cold blasting air conditioners and the volume too loud and things like that. And a way to share what those community resources are with all of you sounded to me like one of the things, at least one of the things we can take away today. I'm also aware that there's a number of things that were going on in the chat that we probably didn't get to, or would have been too deep a dive in the time we had today. We will be collecting all those and synthesizing all those, and then we'll publish after the second of these forums the video, some of the information from the chat, perhaps a frequently asked questions, some sort of document that's responsive to everything that was in the chat today. And so that will be coming. If after you read that, you say, God, Commissioner said he was going to capture my question, and there's nothing in here that's responsive to me, email us again. It's possible that we missed it, or that we misunderstood what you were asking and answered a question differently than you were thinking we might. With that, I want to thank in particular Gunnar and Sarah for presenting today on the strategic plan and on the Supporting Transformation to Empower Lives program. It really is important to us, the work that they're doing and supporting everybody across the agency. I want to thank all my regional staff, central office staff who participated in today's call, my self-advocates who have joined, and all of you out there who may have an intellectual disability or have a life touched by someone who does. We appreciate your time, your commitment to helping us make this better. By this, I mean DDS. We want a better life for all 17,000 individuals eligible for the department. There'll be more of these come. Just because you've come to one doesn't mean you shouldn't come to another, because I promise you, we are always surprised at how the conversation can shift even over the course of 2 days, or what's important to one group based on the conversation. It doesn't even come up in the next group, but something else also really important shows up. So feel free to come again. I appreciate you all, and I hope you have a great day. I can't believe you got to us this early on a Monday morning. It means a lot. Take care.